Obesity-related health complications include heart disease, stroke, type 2 diabetes, and certain types of cancer, some of the leading causes of preventable death. The Diabetes Prevention Program, a major federally funded study of 3,234 people at high risk for diabetes, showed that moderate diet and exercise of about 30 minutes or more, 5 days or more per week, resulting in a 5 to 7% weight loss, can delay and possibly prevent type 2 diabetes. The team of specialists at Better at Home Mederi Caretenders knows the importance of nutritional education and the monitoring of patients with type 2 diabetes.
So many patients really don't understand what to eat having diabetes. Their physicians don't really have the time in the office to go through a full meal plan, or if they do, they really don't understand it. They're embarrassed that they don't understand, and they don't think to ask those questions. So when we go in, especially to a newly diagnosed diabetic, we're going through their cupboards, we're making out meal plans for them, we're explaining to them how to substitute. If you have so many carbs today, then you can't have another food, because carbs turns to sugar. If they're not understanding why they can't keep their sugar down, we're going to go through what did you eat today? Let's write it down. Let's see what you're actually doing so that we can get that under control. Oftentimes they're afraid of doing the injections. We can go out and educate them on how to do the injections. If they don't want to do it themselves, educate a caregiver to do that as well.
By actually keeping our patients healthy and healthier, keeping them active, feeling good about themselves, keeping them in swimming pools and gyms and golf courses, and by being proactive about their health care, we have been successful in preventing a lot of problems that in years past, or many years ago, would cripple the patient and would prevent them to be disactive. By being proactive about the cardiovascular disease, we have been successful in preventing strokes. Controlling diabetes, we have been successful in preventing neuropathies, or by using hip replacement and knee replacement, all these other surgeries, or using other medication preventing severe osteoporosis. We have kept our patients active in the community, and they're enjoying that.
Medicare covers the cost of education because it's going to keep their patients out of the hospital. Education is a huge piece of what Better at Home Mederi Caretenders do when we're going to these patients' home, because they don't understand. And it's our job to make sure that they understand how to care for themselves. They now have a disease that it potentially could be life-threatening. It could cause them to lose limbs or blindness. So it's very important that they understand what they need to eat on a daily basis and how to keep that under control.
The American Diabetes Association recommends testing to detect prediabetes and type 2 diabetes in adults without symptoms who are overweight or obese, or have one or more additional risk factors for diabetes, like having a parent with diabetes or being physically inactive. For more information on the services offered by Better at Home Mederi Caretenders, click the Treating Type 2 StoryLink icon on our homepage, yourhometownhealth.com.